Plastic surgeries are widespread and very common, and they're becoming less invasive with smaller incisions, which allow for a quicker recovery. However, they still are a major surgery and they can take time to recover from. My name is Kelly. I'm a physical therapist that specializes in lymphedema and lymphatic health, as well as oncology. And today in this video, I'm going to share the top tips on how to plan for and recover from plastic surgery. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram, and you can check out our website for more resources. First, the most important thing to do after surgery is to follow your surgeon's protocol. Every surgeon has their own protocol based on the surgery type and what your specific procedure was. It is best to work and talk to your surgeon before surgery to get an idea and the rundown of what the protocol is so that you can be prepared for it. If you have any questions before surgery that weren't answered, be sure to reach out to your surgeon and ask them. If you have any questions or need clarification after surgery, don't ever hesitate to reach out to your surgeon. The next thing to do is to prepare for your recovery. Many will need some sort of assistance after surgery, especially for the first few days. So make sure that you enlist your support system to help be around you, not only to help do things like cook or clean, but also help you with your post-operative care, such as like your dressing changes. Many individuals will have to take a week or two off of work depending on what kind of job they have, and sometimes even longer. If someone has kids or pets, just know that you also may have lifting restrictions after surgery, so you may also not be able to properly care for them. So you want to make sure that you check with that, check with your family, check with your friends, and make sure that you have the proper support. Next, it's important that you have the proper compression garments or compression bandages ready for after surgery. A lot of times surgeons will recommend certain ones or provide them for you, but also many times you have to get them yourself. And so there are different kinds of compression garments and bandages out there, and I will link some of the most popular ones down below in the description box that you can check out. But you want to make sure that you are very diligent on wearing your compression after surgery, because that does greatly affect your outcomes of surgery. The compression garments and compression bandages are also going to be supportive to help decrease your swelling a lot faster and help avoid a lot of swelling from building up. If you have a lot of swelling in an area, you are at a higher risk for infection. So we want to make sure that we're managing that really well. So properly wearing your compression garments and bandages and getting the right and effective kind can really help speed up your recovery over time and give you the maximum results. Another thing is some individuals will have drains after surgery. Some will have 2, some will have 4, and some will have none. But if you do have drains, you want to make sure that you get a drain belt or a drain clip that is more like a lanyard that you can, bathe with, or even just walk around with, or you can look at robes or shirts that all have pockets for drains. You just want to have that stuff ready because it's very difficult to manage your drains if you don't have that support. So I will link some different various options in the description box down below as well. Once someone is cleared by their surgeon, then it's a great idea to start manual lymphatic drainage. Lymphatic drainage is a gentle massage-like technique that is used to help move lymphatic fluid out of an area. This is going to help reduce swelling, speed up recovery. It can also help reduce your risk of getting an infection after surgery. Lymphatic drainage should be done by a certified lymphedema therapist for safety after surgery, but it is something that someone may need to do long term, and it can be done on your own if you learn that proper technique and you're cleared to do so. That is because swelling and edema can ebb and flow for months or even a year after surgery. And so don't be surprised if you see little bouts of swelling throughout a long timeline, and that is something that you can use lymphatic drainage for. Another thing a certified lymphedema therapist may teach you to use are different foams and paddings with your compression to help reduce swelling a little bit faster, but also to help soften any fibrotic or thickened tissue or decrease scar tissue. There are different foams and paddings that give nice compression to soften, and there are also some softer versions that are more pillow-like that have small chipped foams in there to give a more comfortable compression to help with that recovery process. So I will link some of my favorite ones in the description box down below. And if you're looking for different routines on lymphatic drainage that you can follow along with at home, I have a lot of other videos on my channel for various parts of the body that you can check out. After surgery, it's also really important to avoid strenuous activity, especially until you are cleared by your surgeon and your incisions are fully closed. We don't want to open them up, and we also don't want to add a lot more inflammation to an area when you're trying to recover. Generally, if your surgeon says it's okay, walking is a great form of exercise just to gently get fluid moving so we're not pulling in the legs or increasing the risk for blood clots. Another thing that's important to do is stay well hydrated and drink plenty of fluids. We want to make sure that we're constantly flushing the area, and you also want to make sure that you're just eating a healthy diet just to get all the nutrients and vitamins that you need for proper recovery. Just remember that overall, this is a major surgery on your body and it can take time to recover from. These are some tips and tricks that I found over the years that work really well for my patients to help speed up their recovery. Always make sure that you check with your doctor and your surgeon for clearance for safety and reach out to them for more personalized guidance. If you have any other videos that you want to see topics on related to this, be sure to comment those down below, and we'll see you all next week in another video. Thanks everyone.